Good afternoon, and thank you for joining our training today on navigating the PSYCKES Recipient Search for Population Health, hosted by the Office of Population Health and Evaluation. Before we jump into today's training, I do want to share our agenda. So we'll start with a brief overview of PSYCKES, what it is, who's included in the application, and what types of data are available. Then we'll discuss the process of enabling access to client-level data. And then most of our time today will be spent walking through the recipient search features, including the individual and cohort search options, the logic used for searches, and the advanced views you can apply to make your searches more efficient. We'll also go through some example searches to demonstrate how you might use the different cohort search filters. Then finally, at the end of the webinar, we'll share some training and technical assistance resources for you. So let's go ahead and begin with our PSYCKES overview. So PSYCKES stands for the Psychiatric Services and Clinical Knowledge Enhancement System. It's a secure and HIPAA-compliant web-based application that integrates Medicaid data with data from other state administrative databases in a user-friendly format. It's designed to support population health, quality improvement, care coordination, and clinical decision-making. So we currently have over 13 million individuals viewable in PSYCKES. It includes anyone with a history of Medicaid-funded behavioral health diagnoses or treatment, state psychiatric center inpatient or outpatient services, or health home outreach or enrollment. If an individual falls within one or more of those categories, their data will be included in PSYCKES. And some examples of data you can find in PSYCKES includes general medical information, behavioral health services, crisis services, residential support, and laboratory and pathology results. So let's talk a little bit more about what kind of data is available in PSYCKES. We do have several different data sources feeding into the application. A client's clinical summary provides up to 5 years of data, and that's updated on a weekly basis. Our biggest data source is Medicaid billing. So that's Medicaid fee-for-service claims and managed care encounter data across treatment settings. And I do want to highlight that there is a little bit of a lag between the time the service occurs and when the service shows up in PSYCKES. So with things like outpatient or inpatient services, they can take a couple of months to be incorporated in a clinical summary. That just all depends on the billing turnaround time. And that's why we have our other data sources, state administrative databases. Those are a little bit more real time, and they have a typical lag of anywhere from 0 to 7 days. And we do have quite a few data sources here, so I'll just talk through a couple of them. We have New York City Correctional Health Services. So if someone spent some time receiving jail-based care, that data will be included in the application. We also have New York City Department of Homeless Services data. So that includes shelter and care coordination data for homeless individuals. We also have health home enrollment and CMA provider information from DOH MAP. So that's the name of the health home and their contact information in the application. And if someone has been in a state psychiatric center, we have electronic medical record data from those PCs feeding into PSYCKES as well. We also have suicide attempt information that comes from NIMERS, and that includes all available data. So if an individual has a suicide attempt on record from 15 to 20 years ago, for example, that would still appear in the application. PSYCKES also includes screenings, assessments, safety plans, and other documents like psychiatric advance directives that could be entered by you as the provider or the client themselves through PSYCKES My Choice. Lastly, we have intensive mobile treatment, AOT referral under investigation, and mobile crisis team information coming in from DOHMH Maven. And again, there are quite a few data sources listed here, so that's just a couple of examples. Now let's take a look at the quality indicators or quality flags we have included in PSYCKES. The Office of Mental Health has identified a number of health conditions or achievement issues that are important for us to track. So PSYCKES identifies clients flagged for those health conditions or treatment issues, and it rolls up prevalence rates as aggregate data shown at the program level, the agency level, the network level, and so on. This way, the client's provider, the network, their managed care plan, their local county, or even state government leadership can identify opportunities for improvement and take the necessary interventions to help those individuals. You can access this quality indicator data by reviewing the statewide reports in the MyQI reports in PSYCKES, which are both updated monthly. So some examples of the quality indicators we have in Psyches include no diabetes monitoring for individuals with diabetes and schizophrenia, low medication adherence for individuals with schizophrenia, high utilization of inpatient or emergency room services, and eligible for Health Home Plus, no Health Home Plus service in the past 3 months or 12 months. If you have any questions about why someone might be included in a given quality indicator, you can always go to the quality indicator page we have on the Public Psyches website and review the technical specifications we have listed there. You can also email our help desk if you have further questions beyond that, and we will be sharing their contact information at the end of our training. Another aspect that I did want to touch on was our performance tracking indicators. So for example, we have our general medical performance tracking indicators, and those just highlight clients that are overdue for certain screenings or who might not be taking or adhering to medication for certain conditions like cardiovascular disease or asthma. So these are unique indicator sets in Psyches because DOH calculates them on what we call mature Medicaid data. They're calculated after a 6-month billing data maturation period to allow for service invoicing. So the as of date you see in the application reflects the most recent performance tracking run by DOH. So for example, right now in June, the performance tracking indicators are as of December 1st, 2025. And those measures are based on a 12-month period of services. So all of this data we've covered so far is available in different types of reports in Psyches. So we have our individual client level reports, and those are our clinical summaries. Those include Medicaid and state database treatment history and provide up to 5 years worth of data. We also have several different provider level reports. So first we have the MyQI report, which displays current performance on all quality indicators and allows you to review the names of clients who are flagged. If you're a provider level user, you can enable access to view the clinical summary for specific recipients. And then similarly, in the cohort search, you can run ad hoc reports to identify cohorts of interest, and that's within the recipient search. We have different advanced views for recipient search that show you different aspects of client's history that you might be interested in. And you can enable access to client data through this as well to view clinical summary information. And of course, this is the topic of today's training. So we'll be discussing recipient search in those advanced views in much more detail later on. Next, we have our usage reports, which will help you monitor PHI access by staff members. So you can go into that section of the application and see who is viewing clinical summaries for specific recipients, who is enabling access, and the justifications they are selecting for that access. So let's say a provider enables access due to a clinical emergency, or if they have gotten signed consent, you'll be able to view that in the usage reports. Then we have utilization reports, which are used to support providers that have value-based payment data needs. And then lastly, we have our statewide reports. And there you can look up the quality flag and review the statewide prevalence by provider location, region, and county, client residence and county, plan, network, and provider. And those are all at the aggregate level. All right, now that we've covered what Psyches is and the basic features it includes, let's talk more about how you can get access to client level data. So there are 2 ways a client can be linked to your agency. That's automatically and manually. A client is linked to your agency automatically when they've had a billed service at your agency within the past 9 months, or if they are currently enrolled in a health home or care management agency according to DOH MAP. You can also link a client to your agency manually, and to establish that manual linkage, the provider just needs to attest the client signed a consent form. So that could be the standard Psyches consent, the DOH Health Home Patient Information Sharing consent, or BHCC consent. They can also attest the client provided verbal consent, or that this is a clinical emergency, or that they are currently being served by or transferred to your agency. And we'll just drill in a little bit more on those different levels of access. Having a signed consent of one of those 3 types I mentioned will allow you access to all available data. And that includes data with special protections, such as substance use, HIV status, family planning, or genetic testing. And you will have access to that data for 3 years after their last billed service. If the client has given you verbal consent but hasn't signed a consent form, That will allow access to limited data for 9 months. So that excludes that data with special protections. If it's a clinical emergency, you will have access to all available data, and that includes that specially protected data for 72 hours. And then finally, we have attestation of service, which is when the client is currently being served by or transferred to your agency. That will link the client to your agency for recipient search reports, so they will be returned in recipient search results, but it will not provide access to that client's clinical summary. Now let's go ahead and walk through the Enable Access module quickly. To look up a specific individual, you'll want to navigate to the Individual Search tab on Recipient Search and enter your recipient identifiers. And it's easiest if you have a unique identifier, like their Medicaid ID or their Social Security number. But you can also search by additional identifiers, such as their full last name and their date of birth and/or their first name. You can also include characteristics like age, gender, race, ethnicity, region, and county. So here we just have the first individual search screen, and this is the landing page you will come to when you select recipient search in the navigation bar at the top of the page. Once you've entered your recipient identifier or identifiers, you're going to select this individual search button in the top right-hand corner, and you also have the option to reset your search if you need to. The next step is to view the search results and confirm that the client's information matches the client listed in your results. So from here, you'll be able to see the client's name, gender, and age, their Medicaid ID, their race and ethnicity, their managed care plan, if they have one, their Medicaid quality flags, and any planning considerations that are listed in their clinical summary. So that's notifications like complex needs, Health Home Plus eligible, high mental health need, or mental health placement consideration, and any documents they might have, like their safety plans or psychiatric advance directives, just to name a few examples. So if there's a match and they have not already given consent, you can go ahead and select the Enable Access option in the current PHI access column. I do want to note it's really critical to ensure that you're enabling access for the correct client. If there isn't a match between the client you're searching for and the client that comes up in the results, or if you don't find any results for your search criteria, you can select Modify Search on the left-hand side of the screen to return to the recipient search page. So when you select Enable Access, it will bring up the PHI Access module where you can select the appropriate level of access. You might have slightly different access options based on what kind of facility or agency you're coming from, but the ones that we're showing here are what community provider users will see. So here we have, under the client signed consent, we have our 3 different consent forms, so PSYCKES consent, the BHCC patient information sharing consent, and the DOH Health Home patient information sharing consent. There's also a client gave verbal PSYCKES consent, and this is a clinical emergency, as for our other reasons for access. And then at the bottom here, we have the client is currently served by or being transferred to my agency. And that will link the client to your agency, but again, it will not in itself provide access to the clinical summary. So here we have the client signed a PSYCKES consent form selected. But if you're not sure what one of these options means, or if you'd like to learn more about what each access level entails, you can select this About Access Levels link that's available at the top right side of the screen. The next step in the process is to confirm the client's identity. This step in the module will show you their unique identifiers, their date of birth, and their address. And then you have 2 options that you can select to explain how you know this is the correct person. The first is that you as a provider are just attesting to the client's identity, or that the client provided either one photo ID or 2 forms of non-photo ID. And if you select that latter option, you'll also need to select the type of ID or IDs that the client provided from the drop-down menus underneath. So once you've filled that out, you can select Previous to return to the last step, Cancel to close the Enable Access module, Enable to enable access and return to the recipient search results, or you can enable and view the client's clinical summary. So that will just take you right to their clinical summary page. So when you select the Enable option, this is the screen you will return to. You'll see that the client's name is now a selectable link, and that the current PHI access column will now include the level of access you just enabled, as well as an option to update the access level. Then if you select Enable Access and View Clinical Summary in the PHI module, you'll be brought to the client's clinical summary. And this is just an example of what that will look like. So if you selected Sign Psyche's Consent, as we did before, you will be able to see all of the data that they have that's available in the application, including data with special protection like substance use history or HIV status. And up here in the upper right-hand corner, you can select whether to show that information or hide it as needed. Then you can drill into the client's data further by selecting this full summary view as opposed to the brief overview, which the clinical summary will default to showing you. And you also have the option to export the clinical summary to Excel or PDF. So now that we've walked through that process of enabling access to client data, let's jump into the main part of today's session, an overview of the recipient search function. So as we've touched on already, you do have two options within recipient search, the individual search, where you can search for one person by their unique identifiers, and the cohort search. Cohort search is a flexible search you can use to identify cohorts of people served by your agency who meet specific criteria. There are quite a few filter options available in the cohort search, and we'll cover each group of those in detail later. But some example groups we have here are population and planning considerations, managed care and Medicaid, medication and diagnoses, and services by a specific provider. So the recipient search page is now divided into two tabs, one for individual search and one for cohort search. And this is our individual search tab with the options to search by Medicaid ID, social security number, name and date of birth, and any characteristics you might want to include. Just as a reminder, it's best to use the most specific information you can here to avoid any confusion between maybe clients with similar names or the same date of birth, for example. And then before you select search, you can also choose between searching the full Psyches database of clients or just clients who are already linked to your agency. And then this is what the cohort search tab looks like. Cohort search also gives you the option to filter by characteristics such as age range, gender, race, ethnicity, client region, and client county in your search. However, here you can combine those characteristics with different filters related to your client's behavioral and medical health history. So one thing I do want to note is that cohort search only shows recipients that are automatically or manually linked to your agency already, not the full Psyches database. Unlike in individual search, you won't be able to switch between those two search options. So we have all these different filter dropdowns you can select from, and we'll cover each one in detail in just a little bit. At the top of the cohort search page, we do have the characteristics group that we just touched on. We have populations and planning considerations, social determinants of health, and managed care plan and Medicaid. Further down on the page, we have the quality flag section, the medication and diagnosis section, services by a specific provider, and services by any provider groups. And just to give you a little bit of insight into the cohort search logic, it uses what we call an and/or logic. So if you select multiple options within the same filter box, that creates an OR logic. And you can make those multiple selections by just holding the control key on your keyboard. So OR logic just means that the recipients you get in your search results will meet one of your selected criteria, not necessarily both. So say you went to the medication and diagnosis section and selected schizophrenia and major depression disorder from the behavioral health diagnosis list. The recipients in the search results will either have schizophrenia or major depression disorder because those two diagnoses are from the same filter box. On the other hand, making multiple selections from separate filter boxes creates an AND logic, which means that recipients in your search results will all meet all of your selected criteria. So for example, if you went to the medication and diagnoses section again and selected schizophrenia from the behavioral health diagnoses list and type 1 diabetes from the medical diagnoses list, the recipients returned in your search will have both schizophrenia and type 1 diabetes diagnoses. And another thing to keep in mind when using cohort search is that different filters have different lookback periods during which the data for that filter is updated. So you'll just want to make sure to read the date at the top of the main filter box. In some sections, you do have the option to select a different lookback period if you want to. So the default for medications, diagnoses, and service settings is the past year. However, other options include the past 6 months, past 9 months, the past 2 years, the past 3 years, or a specific calendar year like January 2023 to December 2023. All right, so once you've selected your criteria and conducted your search, the search results page will include the total number of recipients who match your search criteria, the filters you selected, the names of recipients who match your criteria, and the option to export the list of recipients to PDF or Excel. So the default number of recipients listed in search results is 50. If you need to expand the number of recipients you get in your search, you can go to the Limit Number of Results drop-down menu located on the cohort search screen in the upper left-hand corner. All right, and as we've touched on a couple times now, there are some types of data in PSYCKES that are considered Enhanced Protected Health Information, or EPHI, so they have special protections. That data includes anything related to substance use, HIV status, family planning, or genetic testing. When you select a filter option in cohort search that contains data with special protections, the results page will show you the number of people who match your search criteria, the number of recipients who were excluded from your search results because you do not have signed consent or emergency access, as well as the number of names that are included in your search results because you have signed consent or emergency access. Okay, now let's talk about the filters we have available in cohort search in some more detail. So we'll start with just characteristics at the top of the page. So we have age range, gender, race, ethnicity, client region, and client county. Then we have our populations and planning consideration filters, and that includes population, high need population, AOT status, alerts, homelessness alerts, complex needs, and plans and documents. And let's go ahead and drill into some of the options available in this section. So starting with our population filter dropdown, we first have people who are OPWDD services eligible and have the Medicaid restriction exception code 95. Then we have people receiving OMH outpatient specialty mental health services, and some of those might include ACT, CCBHC services, HCBS services, and partial hospitalization services. And that's just a few examples. Next, we have people with behavioral health high needs dual. So those are individuals who are 21 and over, who are enrolled in both Medicaid and Medicare, and who meet behavioral health high need criteria. Then we have people with high mental health need. Again, to name a few examples of criteria for this filter, these individuals might have had AOT or ACT in the past year. They might have had intensive mobile treatment with a mental health diagnosis. They might have had 3 or more inpatient visits for mental health within the past 13 months, or 4 or more ER visits for mental health in the past 13 months. And then finally, we have people with mental health placement consideration. And this filter option was created to help identify individuals who require an evaluation before they are admitted to certain adult homes. Okay, so our next filter is high need population. We do have, again, quite a list of filters here, so I'm just going to highlight a few of them. The first one is community-oriented recovery and empowerment, or CORE, eligible. This allows you to identify individuals who are eligible to receive services in their own home or in their community based on their HARP eligibility status. That filter is updated weekly. Next, we have high Medicaid inpatient or ER costs, non-duals, top 1% and top 5%. These filters identify Medicaid recipients with 1 or more inpatient or ER services who represent the highest cost statewide that are linked to your organization. And these filters are both updated monthly. Then we have filters for the On Track NY Early Psychosis Program. They identify individuals currently receiving early psychosis clinical services from an On Track New York program, or who have been discharged from that program within the past 3 years. And those are also updated monthly. Then we have intensive mobile treatment from any provider in the past year. This is updated weekly from DOH Maven. There's also high fidelity wraparound, likely eligible. That is a care management approach for youth with serious emotional disturbance who have significant cross-system needs. So that will capture individuals who are between the ages of 6 and 20, currently health home enrolled, and who have a K3 serious emotional disturbance status or 2 mental health diagnoses, and who have received certain services within the past year. Right underneath that, we have Health Home Plus eligible. And then finally, we have ACT enrolled or discharged within the past 12 months. Next up, we have the alerts filter. This allows you to search for clients with a history of suicide attempts, suicidal ideations, self, self-harm, or opioid overdose within different time frames. Next, we have homelessness alerts. So these are pulled from both the New York City Department of Homeless Services and Medicaid. So at the top, you can filter for any homelessness or any in the past year from both DHS and Medicaid. Then the second section here is just from DHS. You can filter for shelter, outreach, behavioral health shelter, or safe haven or stabilization shelter within the past year. And then in terms of the data for Medicaid at the bottom here, you can filter for any homelessness in the past year, unsheltered homelessness in the past year, and sheltered homelessness in the past year. This filter does allow you to select up to 4 options. Next, we also have the complex needs filter. Um, Criteria for that includes AOT active or expired within the past year, ACT enrolled or discharged in the past year, intensive mobile treatment in the past year with mental health diagnosis, Health Home Plus service in the past year with mental health diagnosis, so on and so forth. So you can also search for individuals with any complex need criterion here at the top, or you can select up to 4 specific criteria from this list. All right, now that we've covered the populations and planning considerations group, let's move on to social determinants of health. So they are organized by domain categories here, like problems related to physical environment, problems related to other psychosocial circumstances, etc. So you can either select a whole domain category or expand the category by selecting the dash next to the category name. That will let you select a specific condition from that domain. And again, you can select up to 4 at a time in this filter box. The conditions do come from Medicaid billing Z codes. So if a recipient has limited or no Medicaid history, they might not have social determinants of health available in their clinical summary. So here we have an example where under problems related to housing and economic circumstances, we have unsheltered homelessness, extreme poverty, and food insecurity all selected. Next, we have managed care and Medicaid filters. And here you can filter by the specific managed care plan, the managed care product line, the Medicaid enrollment status, Medicaid restrictions, the children's waiver status, HARP status, HARP HCBS assessment status, and HARP HCBS assessment results. And I do just want to zoom in a little bit on the Medicaid enrollment status filter. So in this dropdown, you can filter by Medicaid status, such as active or inactive, the recipient's type of coverage, whether they're on a Medicaid managed care plan or if they're just fee for service, and whether a Medicaid recertification is due soon. And looking at these Medicaid recertification filters a bit more, we have filter options for Medicaid recertification due within 3 months in general. We have a filter option for recipients who need to renew their Medicaid via the New York State of Health. And we also have an option for recipients who need to renew their Medicaid via the local Department of Social Services. Moving on, we have our equality flag list here. So you can filter by quality flags like eligible for Health Home Plus, not Health Home enrolled, polypharmacy, adherence to medications like mood stabilizers and antipsychotics, treatment engagement, and plenty of others. You can also select up to 4 quality flags to include in your search here. And I want to point out that in the upper right-hand corner, there is a link to the definitions of each quality flag. And that's going to pull up a separate PDF that will give you just a quick definition of each of the quality flags we have listed. And if you have questions beyond what those definitions provide, again, feel free to reach out to the PSYCKES Help Desk for further explanation. So here is the medication and diagnosis section. You can filter by the prescriber's last name in this free text box at the top. So you can get a list of people who are receiving prescriptions from a specific provider. You can search for a specific drug. You can check off whether it's an active drug or an active medication from the past 3 months that requires prior authorization. And then below that, we have lists of medication types that are included in the psychotropic drug class and the non-psychotropic drug class. Then towards the bottom, we have our behavioral health diagnoses and medical diagnoses lists. And just like in the social determinants of health section, you can also select the dash next to the diagnosis category to view more specific diagnoses. So an example, for example, here we have the anxiety disorders category, and you can just click next to that to reveal more detailed diagnoses. You can also enter the name of the diagnosis or the ICD-10 code for medical diagnoses in the individual diagnosis free text box all the way at the bottom. Then adjust the number of times that diagnosis should be given to a specific client included in your results, and check off whether it's a primary diagnosis. Next, we have our services by specific provider filters. So the provider box at the top will pre-populate the name of your agency. And then you can also select the region, county, and current level of access a client should have, as well as the type of service utilization and the number of visits the recipient has had. In the service setting box, you can check off whether a service has a telehealth code attached to it. Um, you can scroll through the different service setting categories, and again, just expand for more specific service settings under these main categories. So for example, here we have the outpatient mental health category selected, and we've expanded that to choose the ACT adult option. And you can also select up to 4 service settings here. Right next to the services by a specific provider box, we also have services by any provider. That follows a very similar format, but you can enter the name of a specific provider in the provider box, or just leave it blank to search by service setting. So the results will display clients that are linked to your agency who are receiving services from any provider in New York State, not just your agency. And again, here you can select up to 4 service settings. You can also search for high utilizers in the services by any provider option by using a service utilization filter, which then works in conjunction with the number of visits dropdown. So some examples we have here are clinic mental health all, ER behavioral health diagnosis, service or CPAP, etc. And then once you've selected one of those, you can also change the number of visits the recipients in your results will have to see how many people have been using that service frequently. All right, now that we've talked through the different options available in cohort search, let's cover some of the advanced views that are available in the recipient search results. First, you're going to want to navigate to the cohort search. And let's say you've selected the inpatient mental health under the services by any provider filter. If you just search for that, it will take you automatically to the standard view. So this is what the standard view results will look like. This particular search returned 3,201 recipients, and you can see the filters applied at the top. The clients linked to your agency, since that will always be applied to cohort searches, and clients who have had 1 or more inpatient mental health visits from any provider. You'll see a column with the client's name, gender, and age, their Medicaid IDs next to that, then their date of birth, their race and ethnicity, their managed care plan if they have one, their Medicaid quality flags, their planning considerations, and then their current level of PHI access. I do want to highlight here that the content of the planning considerations and quality flags columns are visible whether or not you have access to the recipient's clinical summary. So as you can see in the 3rd row here, this recipient does not have PHI access enabled, but we can still see their Medicaid quality flags and their planning considerations. And if you need to, when you're deciding on which advanced view to select, you can select the icon next to the word view in the top right-hand corner here, and that will bring up a About Search Results View pop-up. And here's what that pop-up looks like. It just gives you an overview of the columns that will be displayed in each advanced view. So here we have standard view, we have the care coordination view, we have complex needs, health home plus, and high fidelity wraparound. We have high need, high risk. We have hospital utilization, and outpatient providers for our advanced fees. So here we've selected the care coordination view. So the first few columns are going to include the same information as before, so the name, Medicaid ID, date of birth, and that other information about each recipient. Um, but it does look a little bit different. Um, these views do highlight recipients who do not have PHI access enabled. So as you can see, the rows highlighted in red here, um, those are the clients that do not have access. Then as you scroll, you'll start seeing information that's relevant to care coordination purposes. So here we have HARP status and age code. We have core eligibility, HARP HCBS assessment date, and children's waiver status and K code. And in this view, you will not be able to see information for recipients who have not given consent. So for example, out of the recipients here who do have PHI access enabled, you can see that one is HARP enrolled and core eligible. One is HARP eligible and has a HARP HCBS assessment date of March 20th, 2023. And another is HARP eligible but does not have core eligibility or a HARP HCBS assessment date on record. Scrolling further, we have the names of health homes that these recipients are enrolled in. We have the names of the care management agencies they are enrolled with. They have their ACT provider, and their On-Track NY early psychosis program provider, if they are enrolled in those programs. So again, here we have 3 recipients who are enrolled with both a health home and a care management agency, and then another one who is not enrolled in a health home or care management agency, um, is enrolled in the early psychosis program with our example provider here. All right, and then the last 2 columns you'll see in the care coordination view are AOT status and AOT provider. If you have recipients in your search results who are receiving AOT, you'll be able to see whether they have an active court order, whether their order has expired and how long it has been since it's expired, and whether a renewal petition has been filed. And then again, we just have the name of the provider here. All right, so that was the care coordination view. Let's move on to our newest advanced view, complex needs, health home plus, and high fidelity wraparound. Again, the first few columns are going to include information from the standard view. The new columns we have here are complex needs, all ages, health home plus eligibility, age 18 plus, and high fidelity wraparound likely eligible for people who are ages 6 through 20. The information in these columns is available even if you don't have PHI access enabled. So in this third row, for example, we don't have any consent or access to the person's clinical summary, but we can see that yes, this person has complex needs, and yes, they are eligible for Health Home Plus. Scrolling further, we have this risk column category. So under that category, we can see whether someone has had AOT active or expired in the past year, if they've had a CNYPC release within the past 12 months, homicidal ideation in the past year, any history of a suicide attempt, an opioid overdose in the past year, if they've been homeless in the past 6 months while having a serious mental illness, or if they've had a K3 serious emotional disturbance in the past year, and that's if they're youth only. So certain categories here, such as that column, will have youth only or age ranges in parentheses next to the column title, just as a reminder that category is only applicable to those specific recipients. Now we're getting into our high ER and inpatient utilization or youth with residential treatment category. So all the way to the left here, we have foster care in the past year for youth only, 3 or more inpatient mental health visits within the past 13 months, state PC and inpatient discharge in the past 12 months, 3 or more inpatient medical and schizophrenia or bipolar diagnosis within the past 13 months. We have 4 or more ER mental health visits in the past 13 months. We have if someone's ineffectively engaged. Then we also have if someone's had 1 or more inpatient mental health visits within the past 13 months for youth only. All right, we'll scroll again to the next screen. This view does include all of the complex needs Health Home Plus and high fidelity wraparound criteria. So there are quite a few columns added on here. So here we have several more youth only columns. We have residential treatment facility in the past year, We have children's community residents in the past year, residential substance use disorder treatment in the past year. And just a quick note on that last one. As I mentioned earlier, substance use related data is considered specially protected data, so that will not show if you do not have either signed consent or emergency access in place, just a reminder. The next few columns are part of the intensive outpatient group, including ACT enrolled or discharged, Health Home Plus service in the past year with a mental health diagnosis, and IMT in the past year with a mental health diagnosis. All right, and if we keep scrolling, we'll reach the end of this advanced view. This last screen shows mobile integration team for the past year for youth, day treatment in the past year for youth, partial hospitalization in the past year for youth, and then we have a final category, crisis services among youth, that includes 2 or more crisis services in the past year and home-based crisis intervention in the past year. And again, those are both for youth as well. This is a lot of data, so you may find it helpful to export the results in this view to Excel and then hide or filter columns as needed. All right, our next advanced view option is high need, high risk. So on top of this standard information, we also have OMH unsuccessful discharge and transition age youth on this first screen. Right, after scrolling again, we'll then be able to see OPWDD, New York START eligible, high fidelity wraparound likely eligible, and Health Home Plus eligible columns. After that, we have a homelessness category that shows homelessness in the past year and any homelessness, and those are both from Medicaid and DHS. Then we have an AOT category that shows AOT status and AOT expiration date. Next, we have a suicide risk column category, including suicide attempt from Medicaid and NIMERS in the past year, suicidal ideations from Medicaid, self-inflicted harm or injury from Medicaid, and self-inflicted poisoning from Medicaid. That's followed by an overdose risk group, which includes overdose opioid in the past 1 year, and overdose risk, concurrent opioid and benzodiazepine in the past 1 year, and as well as a PSYCKES Registries group, which currently just includes the suicide care pathway. Now we have the hospital utilization advanced view. This is a more streamlined view than the others, so there's only one screen. It adds column groups for the number of ER services in the past year and the number of inpatient services in the past year. And those two categories both include the total number of their respective services, so the number of ER services in total and the number of inpatient services in total for each recipient. And then those are broken down by the number of behavioral health and medical services. And then finally, we have the outpatient providers advanced view. So again, on top of those standard columns, we have the primary care physician assignment that's assigned by their managed care plan if they have one. So that'll give the name of the physician, the date of the most recent service in the past year, and the number of visits with the assigned PCP in the past year. Next, we have mental health outpatient provider. So that gives the most recent provider facility's name, the most recent service in the past year, or the date of the most recent service in the past year, and the number of services with that provider in the past year. Then we have the medical outpatient provider, which is pretty much the same format. We have the most recent provider or facility name. We have the date of the most recent service in the past year and the number of services from that provider in the past year. Next, we have substance use outpatient provider, which also follows that same format, and core and adult HCBS service provider. That gives you the most recent provider facility name, the most recent service type, which the other columns don't include, the most recent service in the past year, and the number of services from that provider in the past year. Okay, so those are the example searches. Those are the advanced views, and we're going to look at some example searches now. So first off, let's say I want to identify recipients based on their AOT status. First, I would log into PSYCKES and navigate to the recipient search. Then I would go to the cohort search as well. And then I would find the AOT status filter and select one of the options available there. So that's you have the option to search by recipients with an active court order, those who have a renewal petition filed, those with a court order that expired within 6 months, a court order that expired within 12 months, a court order that's either active or expired within the past 3 years, or one that's active or expired within the last 5 years. Then you can also consider increasing the number of recipients returned. As we mentioned before, the default number is 50, but there are plenty of applications in which you might need to see more recipients who meet your criteria. And then you would just select cohort search. So let's take a look at what this would actually look like in the application. So first, I'll log in, go to the recipient search, and select cohort search. Then I'm going to select the specific AOT status filter I'd like to search with under populations and planning considerations. For the purposes of this example, we're going to go with AOT active court order. Then I'll expand the number of recipients shown on the results page and select cohort search. So here we have 109 results. If you stuck with that default of 50 recipients and need to see everyone, you can go back to the modify search button and change the number of results to encompass all of those recipients. You can see that the filters are listed at the top of the page here, our AOT status filter and our example provider. Then you can select a recipient name to view their clinical summary, export their search results to PDF or Excel, or change to an advanced view as needed. All right, now let's take a look at another example. This time we're going to be identifying recipients who need to recertify their Medicaid. So first, again, you're going to navigate to recipient search and select the cohort search tab. Then you're going to select the appropriate Medicaid enrollment status option from the filter listed under Managed Care Plan Medicaid. So you might select the general Medicaid recertification due within 3 months option, or filter for recipients who need to renew specifically via the New York State of Health or their local Department of Social Services specifically. After that, you can choose from additional filter options if you need to, or expand the number of recipients returned in your results, and then you're going to select search. So again, we'll just log in, go to recipient search, and select the cohort search tab. Then I'll select the Medicaid recertification due within 3 months option that I'm interested in. So here we're just going to select the general one. So that's going to include recipients who need to renew via New York State of Health and who need to renew via their local Department of Social Services. Then I might add another filter onto my search if need be, or expand the number of recipients displayed, and I'll select search. So this particular filter returned 168 results. Again, if you'd like, you can select a recipient's clinical summary for more information, or export those search results to Excel or PDF. All right, another example we have here is identifying recipients based on their HARP status. So here you're going to go to your cohort search. You're going to scroll to the Managed Care and Medicaid filter group and select the HARP status you're interested in from the HARP status filter dropdown. Then you might want to apply additional filters for HARP HCBS assessment status or assessment results if you'd like. And then you're going to go ahead and search. And I do want to just quickly note here that HIV S&P information is considered enhanced PHI since that particular plan is only available to people who have HIV. So that data will only be available with signed consent or emergency access. So here I'm just going to my cohort search and choosing from the HARP status filter. For the purposes of this example, we'll just go with eligible and enrolled so that H codes are just H1 through H9. All right, and here's our results page. It shows that there are 16,053 recipients at my agency who are eligible for or enrolled in HARP. Here I can select a recipient's name to view their clinical summary, choose an advanced view, or export my search results to PDF or Excel. All right, now let's identify some recipients who have received ACT services. So first, you're going to locate the service setting filter box in the services by any provider section. Then you would expand the care coordination service setting by selecting the dash, select ACT, adult youth, and select cohort search. So here we found the service setting filter box in the services by any provider section, and we'll go ahead and expand this care coordination service setting. And here's the expanded service setting, and we'll go ahead and select the Act Adult Youth option. And here is our results page. So that search returned 421 recipients. Again, you can drill into one of these recipients' clinical summary for more details, or export results as needed. Now we're going to identify recipients who are taking either psychotropic or non-psychotropic medication. So first, we're going to locate the medication and diagnosis section. You can type the specific drug name you're looking for into the free text box, or select from the psychotropic drug class or non-psychotropic drug class filter menus. That just depends on your preference and what you're looking for. So once we've made our selections, we're going to click cohort search. And here we've located the medication and diagnosis section. And just zooming in a little bit, we'll either type in that drug name or we'll select a drug class from the appropriate filter box. So for this example, we're going to search for recipients who are taking antipsychotics, and that is listed under psychotropic drug class. All right, and our search has returned 16,746 recipients who are taking antipsychotics. All right, so just one last example here that's going to show you what a search looks like when you're looking for specially protected data. So in this example, we're going to be searching for recipients who are diagnosed with an alcohol-related disorder. So first, we're going to go down to the medication and diagnosis section and find the behavioral health or BH diagnoses box. Then I'm going to expand the category substance-related and addictive disorders and select the subcategory alcohol-related disorders. After I select search, the results page will show the total number of recipients matching my criteria, the number of recipients who are excluded from the search results, and the number of recipients included in the results. So let's take a look at what that actually looks like. Here's the medication and diagnosis box, and we've highlighted the BH diagnoses filters. We're going to, again, expand that substance-related and addictive disorders category and select alcohol-related disorders. Okay, and here is our results page. You can see that it looks a little bit different from our other searches. So we've had 10,266 recipients found by this filter. 560 of those recipients were included in the search results since they have already given consent. And 9,706 of the recipients were excluded because they have not given consent. They will not be visible in the search. All right, so we're coming to the end of our session now. So I just want to quickly go over your options for receiving PSYCKES training and technical support. So for more PSYCKES resources, you can go to our website at psyches.org. There you'll be able to find more webinars on our PSYCKES training webinars page. And those are divided into role-based, feature-based, access-related, and release overview sections, so you can easily find the kind of webinar you're looking for. You can also find a list of user guides on the PSYCKES training resources page, which provide instructions on how to use each section of the application. And then finally, we have some short how-to videos for using the self-service console to manage your RSA token or for reviewing a client's clinical summary. In terms of technical support, if you have any questions or feedback regarding the PSYCKES application, please don't hesitate to reach out to our help desk at psycheshelp@omh.ny.gov, and we're available Monday through Friday from 9 a.m. to 5 p.m. If you're having issues specific to your token or to logging in, you can contact the ITS help desk if you're an OMH employee, or the OMH help desk if you're not an OMH employee, and their contact information is listed here. All right, now before we finish up today, I did want to set aside some time for questions. Have we had any questions come in, Michelle?
Hey, Cameron, there were two questions that came in. The first one is there a way I can search for clients who have signed the PSYCKES consent at my agency and that was attested to in PSYCKES?
Yes, so I believe you can go to the services by specific provider filter in cohort search, and there should be a drop-down menu there that allows you to select the kind of consent that the clients should have signed already. So if you just select that, your results page will show clients who have given consent.
Perfect. Thanks, Cameron. The last question is there a document that shows us how often the information is updated in recipient search?
I believe there is, but I will have to get back to you on that so I can identify the specific document.
All right, perfect, Cameron. Thank you so much. That's the end of the questions.
Awesome. All right. Well, thank you, Michelle, for sharing those questions, and thank you everyone for joining. We'll be sharing these slides and recording on our public website, so those will be easily accessible. And I hope you all have a wonderful rest of your day. Thank you very much.